if we look at this example here, so this person is bending forward and their spine is rounded through that position, which you can see on this left-hand side here. This is what would happen. So the normal shape of the spine, or the neutral spine, has even pressure across the disc from the back to the front. Whereas when we flex with a load, what will happen is we'll end up with a lot more compression at the front of the disc, and that pushes that nucleus pulposus backwards. And that's what causes that bulging disc at the back of the spine. Okay. And you can imagine like a jam sandwich over here, or a jam jelly donut. If you squash the front, the jam will get pushed out to the back. Conversely, with extension, which is basically bending backwards, if you overbend backwards with a load, rather than putting a lot of pressure on the disc, we actually tend to put pressure on what's called the facet joints. And so you'll end up having a joint irritation or a joint injury. And so as a physiotherapist, the way we fix these two problems is completely different. This would involve more extension exercises like Cobra extensions, whereas this one will be more flexion exercises. And so a conclusion for that is that bending forward under load with a flex spine will increase compressive forces on the disc and increase the risk of a disc bulge. So myth has been busted. It is true. And in everyday life, if we look at who are the most efficient lifters on the planet, or everyone in general, really, they all use the same technique.